Biostimulators are all the rage nowadays. We have injectable products like Sculptra and Radiesse. I'm often asked, which is better, what's the difference? I'm Dr. John Leonardo. I'm a chronic pain physician and a board-certified anesthesiologist. In addition to these disciplines, I practice aesthetic, regenerative, and sexual medicine. Biostimulators are compounds that trigger the body's natural regenerative processes, resulting in long-term skin health and structure. Sculptra is PLLA, that's short for poly-L-lactic acid. PLLA stimulates fibroblasts to upregulate production of Collagen Type 1. Fibroblasts reside in the dermis and also on top of the bone on the periosteum. I like injecting this product deep down onto bone because I want to fortify and really strengthen bony structures. PLLA is reconstituted with sterile water for injection. So it's fantastic in terms of global volumization, all areas of the face, particularly high-risk areas like the temples and the piriform aperture. Since it's mostly water, if vascular occlusion were to happen, often it's subclinical or it's something easier to manage compared to other alternative injectables. Radiesse is calcium hydroxyl apatite, or CaHA for short. When injected undiluted, CaHA is a highly viscoelastic substance, which makes it a lot stiffer than just about every HA or hyaluronic acid filler on the market. So when I'm looking to really chisel and contour facial features like the cheekbone, the mandible, and the chin, this is a great product to use. When I'm looking to improve skin quality, I like to dilute my Radiesse. That way it's nice and smooth and I can administer it in the subdermal layer where it can interact with the fibroblasts and it stimulates them to upregulate production of collagen types 1, 3, and elastin. This is the advantage it has over Sculptra, which only upregulates production of collagen type 1. So in summary, I like to play to the strengths of each product. Sculptra, it's like planting seeds throughout the face, so it's great for volumization. It's safer in high-risk areas. It doesn't have any G prime, so it's really not great for really sculpting, but for enhancing the features that you already have. For Radiesse, its strength is its texture, its firmness, its high G prime, its viscoelastic property in order to really chisel and reshape the face. It's also great when it's diluted to really enhance skin quality because we're upregulating production of collagen types 1, 3, and also elastin. So each product really has its own strength, and it's not a question of using one or the other. It's about really maximizing their potential. And often we can use both. If you're interested in these treatments, contact our office, email info@leonardomedicine.com or call 647-223-4436. I'd be happy to help you.